All right, looks good. Well, less stress and shorter recovery time. Valley-based surgeons say that's what's happening with hip replacement surgery, now made much easier. Dr. Douglas Hartzler of Arizona Orthopedic Associates is here to explain. All right, so this is not the traditional hip replacement we're used to hearing about. You say that patients who get this walk the same day. What's the difference here?
The biggest difference is the surgical approach. In other words, we make an incision on the front part of the hip, and it's a muscle-sparing operation, meaning that we do not cut any muscles or tendons. Because of that, and the special technique that we use, we have a special table. It allows patients really to start the recovery and the rehab as soon as they get back to their room.
Wow, okay, and this is known as anterior hip replacement.
Yes, it's an anterior hip replacement. It's been done for many, many years back in Europe. In the last couple of years, we have our first case, I believe, within 2 years ago. We've basically revolutionized how we approach our patients and what we do for them in this hip replacement.
What is recovery like for a patient in the days and weeks that follow?
Some patients can expect to go home the next day after surgery. Some people stay 1 or 2 days. We've cut the rehab period in time in the hospital and recovery following discharge from the hospital by several weeks. Okay. Most people are off crutches within 7 to 10 days, some as early as 2 or 3 days. They return to their work activities, their normal lifestyle within weeks instead of months.
The cost for something like this in comparison to a traditional hip replacement?
It's essentially the same.
Okay.
In fact, it may be less based on the days in the hospital.
All right, well, we showed you there how to get more on the surgery from Dr. Hartzler and his associates. You can give them a call at 602-631-3161. And as you saw there, we put a link. So you can go to our website at 12news.azcentral.com to find out more about this. Dr. Hartzler, thank you for being here. We were saying it's not just something for seniors, but just active adults oftentimes
We're seeing a lot of young people in their 30s, 40s, and 50s that traditionally we'd say wait to have a hip replacement. They're getting them done now.
Getting them sooner.
Yes.
All right. Well, thank you very much for being here. Some important information. We appreciate it. All right, Celeste, back to you.
Thanks, Joe. Back to the news at the top.